see everyone come out and maybe be interested in something a little bit different. When I was first introduced to laser, like a lot of things for me, I had to basically trip over it and then trip over it and then trip over it again. So it took me a little while to wrap my brain around this. And you know, my experience with breast cancer was a little different than Mary's. And when I was diagnosed, I just did happen to get it very early. And I did what I did because I felt like I wanted to give back. You know, just pay it forward. I was really blessed with minimal cancer and no invasion anywhere else. So anyway, cold laser or low-level light therapy came about in the last like 60 or so years that it's really started to be used for healthcare. It's been used for a lot of different things, and I'll bring that out with the PowerPoint. So low-level light therapy works on the cell itself by, one way is to increase ATP production. So that photon of energy, which we're familiar with stimulating the body with electricity and ultrasound and all those things, but this is stimulating the body and the cells with photons of energy from light. So that's one of the things that it does, and we're finding out all the time with the research how many other things it does. It's called photobiomodulation. So it's kind of modulation, meaning that it's normalizing. It's not really a stimulant as much as it is a adaptogen. Okay, does anybody, you know what adaptogens are? Okay, adaptogens just help the body to come back to a normal, you know. There's different herbs that do that. If say your thyroid levels are too high, an adaptogen will help bring them back down. If they're too low, it will help bring them back up. So that's basically what the light does, the laser light does. One thing is that we've learned that a little bit is better than a lot. You know, with our linear thinking, you know, we think that more is better. Right. And with laser especially, we found out that that is absolutely not true. Less is more, and it's called an Arno. Do you know the last word of that?
No, I don't.
Okay. Anyway, it's a theory or a theorem that less is more, and they proved that with the laser therapy, that we can actually stop a positive thing from happening or slow it if we use too much. So what is cold laser? And what is laser? Laser is light amplification by stimulated emission of radiation. I never knew that. I was like, laser. I thought laser was laser, you know? But that's what it is. We stimulate different things, or different types of lasers. Like, for the most part, we use a ruby laser. So it's ruby, I guess it would be crystals surrounding a tube. They stimulate it with radiation that releases electrons, and when those electrons get excited, they go up to a level, and when they come back down to the other level, they release light. Okay. The interesting or unique thing about laser is that it is linear. All the wavelengths line up, and they're all one color. So I'll go through that. The cold laser just means that we don't create heat. Some lasers create heat, you know that. We do surgery now. We can cut through dense metals with laser, but this does not create heat at all. I said about the photon of energy. It's the unique property of being able to penetrate up to 2 inches. Now, some people say up to 5 inches. I'm talking about the particular type of laser I'm using, at the wavelength we're using at the wattage we're using it at. Okay, so it's penetrating about 2 inches into the skin surface, and it increases cellular metabolism with no tissue damage whatsoever. So what's also interesting is, and you know, this is going to quantum physics. So when we stimulate those cells even 2 inches, those cells are now stimulated and stimulating the cells of the rest of the body. So we can treat or stimulate one area of the body with the laser and in your arm, and it will actually react cells throughout the whole body, in your foot and everything. Okay, and I did a little experiment with this, so I know that it works. You know, I had a person with an elbow problem, and I said, okay, one of the ways that I use the laser in the practice is I treat the spinal level, so that's kind of chiropractic based, okay, because I'm a chiropractor, and we treat the spinal level with a frequency, and then we treat the ouch, okay. So I said, I'm just gonna, for kicks and giggles, I'll treat the spinal level, and I'll treat the opposite arm. And they had some pain relief from that. So it's like, oh, okay, so what they're telling us is true. Okay, cold laser is between 400 and 700 nanometers wavelength. I know that probably doesn't matter to you, but there's a lot of lasers on the internet now, and you can go and buy them yourself. So you do want to be careful about what wavelength you're using. Make sure that it's monochromatic, meaning it's one, that is one property of laser, that it is one color. Because different colors in that spectrum do different things. Okay, so you can have purple in that you're still in laser, you're still in that spectrum of light, but if you use purple, you'll be helping different things. Okay, so question.
The ones that they're selling on the internet, how do people know what to do with them?
Yeah, right.
I know.
I mean,
I know. They do come with some training. So yeah, but yeah, you'll see it more and more. They're FDA approved, but usually FDA approved ones need to be by a trained professional of some sort. So that's one of the things you can watch for. If it's not FDA approved, then you know, I don't know. I don't really know.
okay.
But you have to be careful of that.
I had seemed to vaguely have heard something about people getting their wrinkles treated with this stuff. Is that right?
That's one of the biggest things that's being researched right now is, and yes, that does happen because it's tissue repair, any type of tissue repair.
Okay.
We're upregulating cells, we're making them be more efficient and faster of healing, and we're also increasing their ability to divide and fill in. You know, like if you have a cut, the cells that you stimulate with the laser will fill in that cut faster. And I have an example of that. I cut my finger really bad, and it only took about 8 days to get the stitches out. And at that point, I had to take them out because the skin had grown so much and healed so much that I had to pull them out.
The vet, Rigo, is using laser on animals for their wounds.
How come this isn't on the cover of Time magazine?
Well, it's another story.
How about inflammation?
Inflammation is exactly what it's been. The lasers that I use, that's what they're approved for. FDA approved for pain, inflammation, nerve pain, any type of healing, wound healing. That's what they're for.
How about detox?
Yes, because you're detoxing on a cellular level, okay? And I'll get to that. We upregulate cytochrome C oxidase and all of those enzymes. There's many different enzymes that help in oxidation, and that's what the laser helps to upregulate those. When I say upregulate, it's just increasing their ability to work and how much they work. It charges them, okay? Instead of giving it an electrical charge, you're giving it a photon of light charge, and that goes everywhere, okay? And it helps to increase how that happens in each individual cell. So yeah, it's a mouthful. Okay, so the light beams are coherent. They all line up. So that's one of the other things that makes laser different than sunlight. Sunlight acts different on us because it spreads out. Laser light does not. It's all the beams are coherent. They're coherent and they're lined up with each other as far as the wavelengths go. That's why we can be very specific with wavelengths that we're using. And again, it's monodirectional. The laser that I use is a 635 nanometer red light spectrum laser. So like I said, we have cold lasers that are in purple And we're finding out that that has different properties and does different things to people or for people than the red does, okay? And all through that spectrum all the way up to infrared. This one has 5 milliwatts of power, and that's one of the things that we have found in research, that the wattage matters. Some of those lasers that you'll find online, the wattage is pretty high, and it's too much. It's not, you're not going to get a result. It's too stimulatory for the body. And then, of course, I'm looking for FDA, like I said, FDA approved. What do we know? It increases ATP production, like I said. We know that. That's researched. There's no doubt about that anymore. It promotes vasodilation. So it increases heat by that, vasodilation, and it also increases lymph because of that. Okay, you're increasing blood flow, you're going to increase lymph flow. These are some of the enzymes that it helps to upregulate. Catalase, glutathione peroxidase. You'll see that in research. SOD, catalase. Those seem to just be stimulated again by that photon of light. So they react quicker, they react more. And that whole process of oxidation is upregulated.
Does the vasodilation persist, or it's only a short while afterwards?
Once the laser has stimulated the body, then it does persist. How long? That's one of the questions we need to answer. That's one of the reasons why the medical profession is saying, wait a minute, we don't really know what this does. We don't know how it does it. You know, we still don't know all of those things. We don't know how much is a good dose. We don't know what wavelength for what. The lasers that I have, we have protocols that are tissue specific, they're injury specific, they're disease specific. Okay, so we use different frequencies depending on what we want to do,
The
what we're
reason I
trying
asked
to do.
was hypertension.
Yeah, there's so many uses. This is what a person looks like that's on the table. It does increase protein synthesis and healthy mitosis, okay? So we're looking at, okay, well, we're increasing all of these things. Are we increasing it in an abnormal way so that we can stimulate cancer cells? And the answer to that so far has been no.
Well, I think for me, I was like, we're like
Yeah.
filled with this
She
cancer.
should glow with laser.
And
She had laser practically every day for a while. So, you know,
Yeah,
it
and
is healthy mitosis.
Yeah,
And the
that's
other
right.
thing that's being researched right now is, you know how they're looking at telomeres, the telomere of the cell, to determine age or aging, or how far, what's your like biological age, okay? Well, laser therapy now is showing that it can stop the decrease in the length of the telomere and actually help reverse that. Okay,
This is too
so
good to be true.
phenomenal, right? Phenomenal. Why aren't we using this? I don't know. I don't know. It's bactericidal. Bacteria, because of those enzymes that I talked about before, when they're upregulated, more peroxide is created. That will kill bacteria. It will help with killing any invader into the cell. It supports tissue regeneration. Okay, I just said that. If you could have seen what this finger looked like, and 8 days later you wouldn't have believed it. I mean, and plus that, it not numb. It severed the nerve. It was all the way to the tendons, and it's not numb
How did you do it?
anymore. How did I do it? It was a bizarre story. I play volleyball, and I dove for the ball, and I was completely late, but the ball just caught the end of my finger and hyperextended it, and then it popped it. It sliced it all the way across
Wow.
the volleyball. It was a volleyball. I know. I said, nobody could believe a volleyball did that to me. But yeah.
But you had to show people that it really works, because I was an orthopedic nurse for many years, and when you have that, you know, laceration on the finger, your nerves, like,
It
you're,
beats.
well, you have numbness. It takes so long for that to come back.
Yeah.
It does.
This is 6 weeks ago now, and it took 6 weeks, but and I have to be honest, after it felt better and I could work comfortably, I didn't laser myself every day. But yeah, with something like this, you're lasering it every couple of hours, you know, 30 seconds every couple of hours, which seems bizarre to
No,
Cynthia's still
I'm
got
just-
this look
no,
on her face like,
I'm
I
just trying to
cannot
wrap my
believe
head around
this.
this way you did, and of course we were all here saying, how does this relate to me? Of course.
And it improves immunity by what I just said. You're increasing circulation, you're increasing lymphatic drainage and flow. And you're upregulating those immune cells because of all the different enzymes that you activate. Okay, other uses. And again, you're going to see this stuff on the internet. Hair regrowth. They have one for the head. I do some smoking cessation with the one type of laser that I use, and that's what Mary talked about, was with acupuncture points. Okay, weight loss and smoking cessation, they have a protocol for that. Veterinary medicine, like we mentioned before, they're using a lot. I had a really ugly picture of a horse that was hit by a car, and I thought, I don't want to put that out there. But anyway, they showed what the horse looked like, and then what it looked like, I forget if it was 6 weeks later, and they treated it with laser only. The laceration was huge, the whole back end of the horse. But it was amazing what happened. And comparing the time, healing time in the first, I believe they did, the study was the first 20 days, it was 155 times faster with laser than without in the studies. Most of the studies have been done on just healing time. How long does it take? Abrasions, like sports-related abrasions, they did a study on that, and showing that with the laser, it takes a lot less time. Weight loss, there's a laser out there now. This one is using a little bit higher wavelength, it's 700 nanometers, and what it does is it causes the fat cells to expel their contents, and then the lymph system comes in and cleans it up. A little controversial for me, because I'm not sure that that's such a good idea, but I'm very interested in it. I know that people have such a hard time losing weight, and I think that would be a good way to boost them.
Because I just had a lymph treatment down at Farm Mountains about 3 weeks ago, up at Waverly Wellness Center.
I'm sorry, I didn't hear what you said at
I
first.
had a treatment at Waverly Wellness Center, a lymphatic treatment, and I felt great afterwards. Does this operate the same way?
Well, I would have a lymph treatment after I had that done, so that I could help the lymph system take care of all that stuff. Because our bodies store all of the toxins and fat-soluble toxins, okay, in our fat. So if we're releasing that, we would really want to be careful how much releasing at a time, and give the body as much help as we can to get rid of it. Okay. Thanks to photonics, which is what we're calling this, revolutionary techniques have been developed. One of the things that they're developing right now is medications that will go in, and they're tissue specific, okay, and they're photodynamic. So in other words, they're going to be photosensitizers, and they're applying it or getting it into tissue that's abnormal, and then that photosensitizer will cause the cell to be more sensitive to light. They laser it, and it kills the cells. Bacterial invasion, cancer cells, you name it. That's one of the most recent things, and this doc is one to watch. He's doing that research right now. So in other words, when you photosensitize very specific cells and you expose them to the laser, they're the only ones killed. All the normal cells are the same. They stay. They're not affected at all. So you don't have to cut. You don't have to do anything. You just laser shower the person. Okay. What we're trying to figure out, and that's one of the questions of why aren't we using this? Why aren't the MDs just wrapping their brains around this and doing it? And that's why. We don't know the right wavelengths for everything. We don't know exactly how it should be applied, how long, treatment protocols, all of those things need to be answered for the scientists.
You're also making money off prescriptions, too.
Right. You can't start healing people too quickly. This guy, the University of Munich, Germany was probably the country that was the biggest and fastest in jumping on the whole bandwagon with laser therapy, and they've done a lot of work. So a lot of the research that you see is coming out of Germany. and that guy in particular. And then this is the guy that is working on that photosensitizing cells and then treating them with the laser. And then this fellow is pretty interesting. He's here in the U.S. at Mass General, and I have a video of him talking about cold laser therapy and where it's going.
Okay, my name's Michael Hamden. I'm a principal investigator at the Wellman Center for Photomedicine in Mass General Hospital, and also an associate professor in Department of Dermatology at Harvard Medical School. As you can probably hear, I'm not a native of the US. I came from England. I trained as an organic chemist. I came to Boston about 15 years ago and stayed ever since. So my main interests are in phototherapy, the use of light basically to cure disease. Two basic routes that this can be done. One is to combine the light with photosensitizing dyes in what we call photodynamic therapy, and the other is to use the light alone. So photodynamic therapy, or PDT, will usually kill things, but using the light alone in so-called low-level laser therapy or photobiomodulation will tend to stimulate things. So the low-level laser therapy, or LLLT as we call it, is used to stimulate wound healing, to healing of bone fractures or tendon ruptures or cartilage. It's even used for more serious injuries such as spinal cord injuries and traumatic brain injuries and heart attacks and strokes. Reduces inflammation, relieves pain. So the reason people call it low level is that in general low levels tend to work better than high levels, which is the whole concept of the biphasic dose response, or hormesis, that we've been discussing at this conference. So in general,
touches on the time.
few joules per square centimetre of red or near infrared light will be beneficial, but a large dose, such say 50, 100 joules per square centimetre, will be detrimental. At least the good effect will go away and they may be detrimental. So this has been shown in many, many papers, and one of my research interests is to try and figure out why this is. So this involves dissecting the molecular and cellular mechanisms in which the photons are absorbed by the mitochondria. They stimulate more ATP production, low levels of reactive oxygen species, and activate transcription factors such as NF-kappa B, which is a very pleiotropic transcription factor, and cause the translation of many, many gene products that do all the beneficial things of low-level light. So what could be produced at low levels of the light that's good and produced at high levels that's bad? So reactive oxygen species are a good candidate for this. They're well known to stimulate cellular processes at low levels, but to inhibit them at high levels. Nitric oxide is also involved in the cellular mechanisms. It's displaced from various mitochondrial proteins that are inhibited by nitric oxide. And it's possible that the nitric oxide released by the light at low levels does a whole lot of beneficial things, and at high levels does damaging things.
That's all I wanted to do was point out
transcription factors.
with him that they're taking, again, an approach of attacking something and really, not enhancing the body's own ability to heal itself. Whereas the lower level lasers and the way that we're doing it, we're incorporating nutrition, we're incorporating acupuncture and homeopathy to enhance the body's own well-being. Whether you have a diagnosis or a disease or not in part of your body or in your body in general, you still have healthy cells. So what I like to focus on with the way we treat in natural medicine with the laser is to upregulate, again, I keep saying that word, but enhance the body's own ability to heal and try to detoxify it as much as we can and undo some of the things we're exposed to every day. Whereas they do it a little bit different than we do.
Mentioned that NF-kappa B is a protective transcription factor that's anti-apoptosis.
How about the next up in the right corner?
Pro-cell survival. And that, you show that that's...
They're showing
I
us.
just wanna, get rid of that because I have my next.
One assumes insurance doesn't pay for any of this, right?
No, most some insurances do, but not very many yet, so no. Again, I'm talking mainly about the way I use the laser. I use a 635 nanometer laser. It's 5 watts of power, and I have 2 different ways that I use it. The Arconia laser, which is kind of a company that has been involved with chiropractic mostly, so we use this with the chiropractic approach. We're treating a spinal level, and we're treating an ouch, okay? So I laser with certain frequencies on the spinal level, and then I laser the ouch. And then with this laser, which is, it's more of a dot type of laser. I can't get it to turn on here, hold on. I might have ran the battery down. The light beam that gives out is more of a dot, so we're treating very specific points on the body. Whereas this is more of a line.
Is that the one you used for that? Rosemary?
She actually used both, but mostly the other one. With the smaller, the dot, I wouldn't feel it. I really wouldn't feel it so much. But when she used the Arconia one, you know, it's such a bigger area, and it's like, wow, I really feel that.
And we call that laser shower. You know, that type of technique is more of a laser shower than a pinpoint technique.
I have a question for you. Last year, I was reaching, I was by a watermelon. But just listen to this. At the bottom of the bin, I picked it up, and I tore a tendon in my arm. Would that cure that?
Your body heals itself. We're going to upregulate all of the process of healing, okay? And that brings me to my final thing, because I'm going to finish that so we can answer my question. There's so many different ways to heal. And just the fact that you're here, you're open to those things. And we are a healing alliance. So, you know, I just want to stress that. There's so many different ways to heal, and there's so many modalities that we can use. And, you know, Mary and I both used a lot of them: nutrition, homeopathy, herbs, reflexology, cranial sacral therapy, all of those things, colonics, so lymphatic drainage with Sheila. You know, there's just so many things that and ways that we can heal. And I just wanted to see this.
He performs tonight's national anthem.
This is a fellow that has sung the national anthem before this hockey game for 37 years. Boston.
The Boston Fire Department Honor Guard to present tonight's honor.
And he said before he got up there, I'm not sure I can do this tonight.
Oh, sing, can you see by the dawn's
Now he's wavering. He can't hardly get through it, they said.
what so bright?
The entire audience, thousands of people joined him simultaneously with no cue.
Yeah.
No one told them they were going to do it. It just happened.
Yeah.
So whether it's song, whether it's drumming, whether it's homeopathy, whether it's laser, there are ways to heal. And then this is a demonstration of what we can do as the masses when we join together for one thing. You know, whether it be healing from psychosis or healing from physical disease in the body.
So that's kind of like the theory, like when the birds fly, they all turn at the same time, and the fish swim, see if they
And look at those thousands of people, every single one of them. And the interesting thing was, everybody knew the words, too. Nobody messed it up. How many people can do that? I mean, yeah. So anyway, that's it. That's my little introduction to laser therapy. I know you probably have questions, and I hope I can answer them.